Good morning, Susan.
Good morning.
You might be muted.
Oh, yeah, for what?
Oh, I'm okay. Never mind.
Good morning. Good morning. Happy New Year.
So in the summer of 1995, a month after convicting Hall for Jesse Roach's murder, Beaumont was leading a search for Tricia. It was in those same Indiana backwoods where Hall had told Indiana authorities he dreamt he killed and buried Tricia. They wanted to feel like I did everything I could to see if we could find her body. But after 2 days searching, turn out we could find nothing up there. Then Beaumont decided to try something completely different, like most people didn't think I was pretty good, but others.
I'm going to be outside.
Okay,
Now remember, they can hear everything you say.
all right. Hi,
Morning,
Susan.
Dr. Marble.
I'm doing fine.
Good.
I'm snowed in, but I'm fine. Buddy's got cleaning off her truck so she can go if there's an alarm, but we've been pretty fortunate. There haven't been any fire alarms, but there've been a lot of ambulance calls.
They said there were a lot of accidents.
Well, yeah, they slid off the road. There were a lot in the median out there at the Cave Neck Road.
That's why my butt is staying home.
Yeah. Well, that may be going to or from work, you know, you never know.
Yeah.
Can't be too hard on them.
I had a good boss. He always told us to stay home when it was like that.
Well, I'll tell you, there was a real whiteout here. There goes Patty trying to pull her truck out. She must have cleaned the truck off 3 or 4 times yesterday.
Mine's in the garage. I never budged out of the house.
They had a little trouble last night because, you know, when the ambulance goes out, they send a truck with a plow on it because a lot of the developments haven't been plowed. And they couldn't get anybody to drive it. They were just, you know, tuckered out.
You didn't go out New Year's either, did you?
No,
Me neither.
we stayed at home and had dinner. She's trying to flatten the snow down so that the mail person can get to the mailbox.
Are we the only ones here?
I guess so.
I'm here. We've
You
got a
are?
number. I am. We've got a number of attendees on. Oh, and here's Dr. Cowan. So let me,
I like your haircut.
thank you.
It was good.
And Bob Fulton's also here, so I'm going to pull him over.
The gym was taking up Jimmy's valuable time, making it harder to even talk to him. But then he learned Paul's business show was a therapist.
Is your office closed today?
Yes, we were going to open at 10, but then when, I talked to Rick Melendez with our maintenance department this morning, the roads are still very icy. So we decided to close. The county closed as well, so.
Did they? So there was no trash pickup today?
There's no trash pickup, so trash pickup will be Thursday and Friday.
Okay, they didn't notify us.
There was an email blast that went out last night.
I never got it.
Are you signed up for
Because
the
I
email
kept looking.
blast? And
Yeah.
you're okay.
And the phone calls. And,
Okay.
because I got it.
Well, the guys that
Monday
pick up the
morning.
trash are out working on clearing stuff today, so they that's their focus today.
My neighbor just put my trash can out front for me. Bless his
Oh.
heart. I tell him he can go get it.
Well, our neighbors leave their trash can out all week, even over Christmas. Talk about lazy.
Yeah. So it's 9:30. We'll go ahead and get started.
Okay.
So thank you, everyone. I reviewed the minutes from the November meeting, and boy, things have changed a lot in a few weeks, haven't they? So we were in a pretty good spot then, and things are certainly different now. We do have minutes from the September 28th meeting and the November 2nd meeting that will need approvals to approve those minutes.
So
I
moved.
didn't get them. I didn't see them.
I got them.
They were emailed out to everybody.
I don't believe I got them.
Okay. Susan, do you want to wait until you can review them before we remove? Are you okay approving them without you reviewing them?
I am fine approving them. Go ahead.
Okay. So the motion, and I guess technically I can't second that motion, but there's just three of us, so we'll approve both those sets of minutes. So I guess it does bring up a good point before we get started with anything else, that there's just technically three of us that I think that are members of this committee. Anne Marie, is that correct? Looks like she may have dropped off or something. We may need to find another person or two who lives in the town who's interested being on the committee. We had Cheryl Hopple. I'm not sure that we've filled her position yet. I know that we are going to fill it. So if
So
either,
I apologize. We have not yet filled Cheryl's position. So I would expect that would be RL, but that appointment still needs to be made.
sure. Are you a voting member?
I am not.
I wonder if we don't need to find another person or two just so we can legally approve minutes and those kind of things.
Well, so you've got 3 on now, so you've got a quorum, so you can do minutes.
Okay.
I apologize. My phone rang and I needed to grab it.
No, that's okay. All right. Well, if we find somebody who has an interest in the town, we should please feel free to refer that person to me so we can add a little bit more. So, COVID right now is challenging, to say the least. The Omicron variant is ravaging the country, ravaging the state. Our positivity rates are really through the roof. If you look at the My Healthy Delaware website right now, this morning, the 7-day moving average is 23% of tests that are positive, but that's really a vastly understated number, because if you have the access to a home test, you don't get tested. And there's really no mechanism for the state to capture those positive tests. So I suspect that positivity rate is much, much higher than that. So the good news is that, can you still see me?
Mhm.
Yes.
Good. For some reason, I lost my video. Anyways, the good news is that for people that are triple vaccinated, they seem to be, those people that are COVID positive seem to do very well with it. They're sick for just a couple days and are otherwise doing well. The people that are unvaccinated, unfortunately, are really struggling with this. Those are the people that are getting hospitalized. We certainly, our hospitalization rates are probably as high as they've ever been at this point. So, and then the people that are have had 2 doses of the mRNA vaccine, but have not been boosted, they're kind of somewhere in the middle, where they're getting sick, sick for a little bit longer than the people that are triple vaccinated, but tend not to get hospitalized. So it's a plug for people to, it's still not too late to get your 3rd vaccine, and it does seem to make a big difference for us. As I said, although with Omicron, the number of people that are infected with Omicron that are getting hospitalized is lower, the total number of people that are getting infected is much higher. So we're still seeing the absolute number of people with COVID getting admitted to the hospital, unfortunately, is higher. As I said, I think we're at the highest point we've ever been. So it's certainly it's a struggle, and that's true everywhere. Every hospital in the state is experiencing what we're experiencing, and quite frankly, I think every hospital in the country is experiencing what we're experiencing. Certainly, I'm on a couple professional groups with emergency physicians around the country, and they certainly are experiencing what we are here. So, I mean, that's kind of where we're at from.
Well, what's your criteria for admitting people with COVID now? Do you just admit everybody that's positive, or?
No, gosh, no. It's largely based on their oxygen saturation. So if people have an oxygen saturation that is, above 90%, most of those people can go home. So there are some high risk people that will get admitted, even if their oxygen saturation is, say in the low 90s, people that have significant comorbid diseases. But it's basically all based on their oxygen saturation.
Right.
So, I think that if you look at, there's some therapeutics and things have sort of changed with therapeutics based on Omicron. We have monoclonal antibody therapies that we've been using for the Delta variant. The trick with that is the 2 monoclonals that we have the biggest access to are not effective against Omicron. They're effective against Delta. Now, the trick is to know exactly who's Delta, who's Omicron, and that's very difficult to do. I was talking to Anne-Marie yesterday, and we actually don't test that in the hospital. It's a public health test. So you're either COVID positive or you're not for us. And then they kind of give us a percentage of people in the community that are Omicron versus Delta. Right now, it appears as though we are, I think the latest information, I've read 2 different sources, but we're maybe 50-50, maybe a little bit more Omicron than Delta. So when we certainly anticipate that within the next week or 2, that will be primarily Omicron. So there is one monoclonal antibody therapy that we have a very short supply of in the state that is effective against Omicron. And there was an oral 2-drug regimen that was approved for emergency use a few weeks ago called Paxlovid. And that is effective against the Omicron variant. And that's again, a 2-tablet regimen that you take for 5 days. The trick with that medicine, unfortunately, is that there are a lot of medicines that if you're taking, you can't take it. And a lot of those medicines are medicines that people that are at risk are taking. So it's cholesterol lowering medicines, it's blood pressure medicines, it's steroids, it's some of the diabetes medicines. So it's another tool in the toolbox, but maybe not as big of a hammer as what we hoped it would be for it. So, but just another plug, like vaccinations are so important. The people that are triple vaccinated are doing really, really well. Either not getting infected at all, or certain if they are infected, are doing very well with the illness. So, do you have any questions about any of that?
When's it going to go away?
Well, so that's a good question. So COVID in general will never go away, I don't think. I think it's going to be something that we're going to live with like we do with influenza. The good news is that at least from the South African data, and again, Omicron was first identified in South Africa in the end of November, their case rates have dropped precipitously in the last week or two, which is unusual. The other Delta waves the other COVID waves that we've seen, there's a sharp uptick in cases, but then there's a very slow decline over the course of several months. If we follow South Africa, and we may or may not, there's lots of environmental reasons why we may not, vaccination rates, different healthcare systems, that kind of stuff. But if we behave like them, then the Omicron variant will hopefully drop out very quickly being, sometime in February as opposed to April. But that really kind of, is a wait and see. And of course, influenza is back. Last year, we saw no influenza cases. We're starting to see some. So we'll see how that goes. The other issue is masking. There's, been a lot of talk about masking. It's clear that a cloth mask, especially with regards to the Omicron variant, is not very helpful in preventing the spread. Surgical masks, those paper surgical masks, are more helpful, and clearly an N95 or KN95 is the most effective means to prevent transmission. So hopefully we'll see some people masking up, especially if you're in crowded situations where you're not moving around. So there's been a lot of the news recently about masks. I don't know if anybody's questions about those. No. Okay. Bob, how are you guys making out in the schools?
Well, we haven't been in schools for a while.
Yeah.
But before the snowstorm obviously came, we were planning on coming back to school on Monday as we had planned before. And for us, it was sort of looking at our staffing, and I think some places that may be around the country or maybe even in Delaware that maybe were delaying the start, I believe were primarily due to staffing concerns, a number of staff members that were positive and had to quarantine. And with our team meeting over winter break, we felt that we were in a good spot to come back. Our staffing wasn't at the level that would cause us to delay that or not come back with students. And I still firmly believe the best place for students is in school and in person, unless our data shows otherwise. And in fact, I think it's a safer place because a lot of times when students are in other more maybe less structured areas or places, that we see the number of positive cases increase.
Right.
And when kids are in school in more structured environments, then we don't see that. And a lot of times, not every student, when they're not in school, is just at home by themselves all the time. A lot of times they're in daycares, or they're going from one person's house to another because of this, or they're going to a friend's house. And so there's a lot more going on that is less structured. And so that's our plan, to kind of stay that way until our data shows otherwise, or until we have any kind of staffing issue. But we haven't had the spread in school, and we aren't masked all the time in school because we do have to eat and drink, and there are mask breaks. But overall, I think we've done a good job of trying to minimize any type of spread and keep it as safe as possible.
So both your staff and your students are masked? the best you can.
Yeah, the best we can. Obviously when we're eating lunch, we're not, but we work with students and families too, that if we allow for like mass breaks throughout the day. You walk in our schools and you'll see kind of like kids sitting off by themselves, in like little area of the hallway or something where they're taking a mass break. And that's sort of time throughout the day for different reasons, for different kids. And,
Sure.
whenever we can, we try to separate as much as we can and just try to work through those challenges, which there are many of. I do think, it really has helped us. It may be in this area as well, just number of vaccinations. I think the fact that we do have, we haven't had the staffing issues to this point, which would cause us to close for that reason, is because a large number of our staff members are vaccinated, which really has helped us not just to minimize the number of cases, but the health implications to those cases are lessened with the number of staff members that are vaccinated. At one point, I think our professional staff were around 90% vaccinated.
Good.
That's great.
Which makes a big difference when you're trying to run an operation and keep people at work and keep people healthy and feeling safer about what they're doing,
Are your plans for staff, unvaccinated staff, still the same, where they'll be tested twice a week?
Yeah, right. Yeah, there's no plans to change that. It's once they have to provide a negative test once a week for staff. So either once a week. Yeah, and we prior to winter break have set up curative trailers in a couple of different areas in our district. One was in front of the high school. We set that up for our staff to have one location to be tested. And our Sussex Consortium School has another site that maybe is not every week, but as much as we can get it at that site, because a large number of staff members that work there as well. But as you saw over winter break, there were long lines of community and visitors using that curative site in front of the high school, which was great. It wasn't our intention that it would be that way. It was more for staff purposes and a community if needed, but it was definitely a popular place over the last few weeks with.
That was a very good idea.
So Bob, I have a question. So we are also requiring our unvaccinated staff to provide a negative test result weekly. So they would be able to go to that curative trailer?
Yes.
Okay. And that can be booked through the curative website?
Yes. Yeah.
Okay.
Yeah. There's all, I haven't used it often because of being vaccinated, but I believe there are walk-ins available as well, even over the break, I used it once. My parents were visiting. I just wanted to, without symptoms, I still wanted to kind of just get a test to feel better. So I walked up without an appointment, like many others there, and they were given the test.
Okay.
Well.
Okay. Yeah. That's good to know. I'll make sure we share that with our staff.
Those lines were impressive.
Well, I had one of our employees went to Greenwood to test at a curative site last week. And she said that she, even with an appointment, had a 4-hour wait.
Oh my God.
Wow.
So, but hopefully with the holidays, I think a lot of that was just like Bob was saying, people who either found out they were exposed at a, holiday gathering, or, we're going to be seeing vulnerable family members trying to be proactive. So hopefully that tapers off some. Is there any thought, Dr. Cowan, about given that the vaccine is less effective at preventing infection with Omicron, is there any sense that we need to start having our vaccinated staff tests as well?
No, I mean, the CDC.
Okay,
yeah, no, the short answer is no.
Okay.
If you're triple vaccinated and you're exposed, you don't need to test.
Okay.
So.
Yeah, we're also, obviously, we're trying to keep staff and students in school as much as possible. And there are sometimes in the past, when we've had to quarantine individuals just because they were close contact, and they had to wait out that quarantining period. So we're trying to limit that as much as possible. So after break, I believe next week we'll be starting a test to stay program in our schools, where there'll be testing available for those who want it. Once a week, they'll be in each of our buildings. So if we do have any positive individuals, and which cause quarantines for others, those people who would have to quarantine that are asymptomatic could be tested, and they, as long as they test each day, they can come to school the following day.
What are you using for your quarantine time? 5 days or 10 days?
5 days.
5 days, okay.
But,
Um,
so you're saying asymptomatic but test positive?
But yeah, but no, if they test negative each evening, they can come to school the following day, obviously, and follow our protocols. But just it just allows for those who don't have any symptoms and never test positive, just to come back sooner, or come back each day.
Mhm.
And so each school will have the site, and then we'll have those community sites as well that people can be tested in. And so it just allows for less students and staff to be out if they aren't positive and they don't have symptoms. So we'll be starting that next week.
Yeah, there is always the challenge with the frequent testing is that there are people that will remain positive for a long period of time. And it becomes kind of a struggle to know what to do with those people. But that's, it's like everything else here. There's a pro and con to everything. So did you ever think you'd learn so much about public health issues as a superintendent?
No. It became, it's amazing, just to sit in meetings now and just the topics we're discussing. Never thought we'd be discussing them, ever, and never had any kind of classes or training on any of these topics, and just the terminology and the topics and the medical discussions. And it's like, it's kind of, it definitely is interesting and something we thought we'd never have to get this deep into.
The amazing thing is how fluid you become in it. I mean, it is, and even in emergency medicine, some of this stuff is not garden variety emergency medicine for me. So yeah, it's been an unfortunate educational experience, to say the least. So
yeah.
How's the hospital's capacity doing at this time?
We're full. We are, we are very full, and we're kind of using every strategy that we can find to create capacity and to try and manage it. I mean, it's tough. It's definitely tough. The difference between this year and last year is that we saw a lot of COVID last year, but we weren't seeing a lot of other illnesses because everybody was sort of sheltered in place. And as the world has kind of reopened, we're seeing all the things that you normally would see with this significant overlay of COVID. So we would be, if we had no COVID patients in the hospital, we would be busy, but not over capacity. We certainly are over capacity now. So it's a challenge. There's no doubt about it. David Tam has done a nice job and his team of trying to find, extra capacity in the system. So whatever little thing we can do makes a small difference.
Yeah.
But it's challenging, to say the least. So I think that's all I have on my list.
I guess I've got a couple of quick questions, or maybe, communication of what we're doing at City Hall. We are, for the month of January, going to have all of our public meetings virtually. We figure, based on our general demographics, we figure that might be a better way for people to participate, so that we don't have people feeling like they're going to miss something if they don't come in person. So we're going to shift to fully virtual. Our offices are well, today they're closed, but not because of COVID. our offices are going to remain open, but our public meetings are shifting to virtual.
Okay.
Are there any large gatherings planned in the near future in this area? I'm not aware of any.
Not that I'm aware of. The holiday festivities are done, so we don't have to worry about those types of things. So I think, that this is in our area, this is kind of the slower time anyway. People tend to go to Florida where it's warmer, and the rest of us tend to stay in because it's cold. We've got something in our Q&A. It's anonymous, so typically we do not answer anonymous questions, but since it's a question, not a comment, I think, how does 2 doses of the J&J vaccine work with the new variant?
The Johnson & Johnson vaccine is not recommended for 2 doses that I'm aware of.
Okay.
So the recommendation from the CDC is if you had a single dose of Johnson & Johnson that you should receive, your second dose should be one of either mRNA, either the Moderna or the Pfizer products. There is data, though, that you definitely would benefit from an additional dose.
I saw a news thing in, I think it was on NPR yesterday, that Israel is actually now starting with the 4th dose.
Yeah, I've read that.
So that'll be interesting to watch how that.
Yeah. Are there any other comments from the participants?
Doesn't look like it.
Okay. So we already have the next meeting scheduled.
Great.
I don't have that date right in front of me. Emery, do you have it?
I believe it's January 25th.
That sounds right.
So we're going to keep that one.
Yeah.
Okay. I
Okay.
see you have a visitor behind you.
I do, yes. She's been in the snow and she's come to find out where I am now.
So it's January 25th at 9 a.m.
Okay,
Okay.
great.
All right. So
Great.
we'll see you all then.
Okay.
Great.
Stay
Nice to
healthy.
see
Right.
you.
I'll be safe.
All right,
Yes.
see you. All right, bye.
Everyone.